The pancreas is a small yet powerful organ located deep in the abdomen, nestled behind the stomach. Though it often operates quietly in the background, it performs two vital functions. It aids in digestion by releasing enzymes and helps regulate blood sugar through insulin production. When this organ is compromised, whether by inflammation, infection, or cancer, it can have serious effects on your entire body. Many pancreatic diseases develop silently, and by the time symptoms appear, the condition may already be advanced. Being informed about the early warning signs of pancreatic disease can potentially save lives. In today's video by TrendPop, we're diving deep into the top 10 signs that could indicate pancreatic problems. Signs that are often overlooked but should never be ignored. Number 1. Abdominal pain that doesn't go away. One of the earliest and most common symptoms of pancreatic disease is abdominal pain. This isn't your average stomach ache. It's often a persistent, dull ache that can radiate to the back, especially in cases of pancreatitis or pancreatic cancer. The pain might intensify after meals or while lying flat, making it difficult to find relief. In chronic pancreatitis, this discomfort can be ongoing and debilitating, affecting your ability to eat, sleep, and function normally. For pancreatic cancer, back pain might be the first noticeable sign that something is wrong. Ignoring this type of pain can delay diagnosis and treatment, so it's crucial to pay attention to any unusual or lasting abdominal discomfort. Number 2. Jaundice, yellowing of skin and eyes. Another telltale sign is jaundice, which causes the skin and the whites of the eyes to turn yellow. This happens due to a buildup of bilirubin, a yellow pigment found in bile. In pancreatic disease, particularly cancer, tumors can block the bile duct, preventing bile from draining from the liver into the intestines. This blockage causes bilirubin to accumulate in the body. Besides the yellowing, you might also notice dark urine, pale stools, and itchy skin. Jaundice is often one of the first visible signs of pancreatic cancer and should always be checked by a medical professional as soon as possible. Number 3. Unexplained and rapid weight loss. Losing weight without changing your diet or exercise routine can be alarming. When it comes to pancreatic disease, this weight loss is usually due to malabsorption, the body's inability to digest and absorb nutrients properly. The pancreas is responsible for releasing digestive enzymes that help break down food. When these enzymes aren't produced in sufficient quantities, it results in nutrient deficiencies and unintended weight loss. Furthermore, a tumor in the pancreas can increase metabolism or reduce appetite, contributing to the rapid drop in weight. Unexplained weight loss is a red flag that should prompt immediate medical investigation. Number 4. Ongoing digestive issues. The pancreas plays a central role in digestion, so when it's not functioning properly, digestive problems are inevitable. You may experience frequent diarrhea, bloating, indigestion, or steatorrhea, which are bulky, oily stools that are difficult to flush. These symptoms suggest that the body isn't absorbing fats and other nutrients effectively. Chronic pancreatitis and pancreatic cancer can both impair enzyme production, leading to these issues. If digestive discomfort becomes a regular part of your life, it could be a sign of underlying pancreatic disease that requires proper diagnosis and intervention. Number 5. New onset diabetes without explanation. The pancreas is responsible for producing insulin, the hormone that controls blood sugar levels. When this function is disrupted, as can happen with pancreatic disease, it may lead to sudden-onset diabetes. This is particularly significant in people over the age of 50 who have no prior history of diabetes. If you begin to notice increased thirst, frequent urination, unexplained fatigue, or a sudden drop in weight, your pancreas could be the culprit. In some cases, pancreatic tumors can destroy insulin-producing cells, triggering diabetes. Doctors often view unexpected diabetes as a possible early sign of pancreatic cancer, especially if it's accompanied by other symptoms. Number 6. Persistent nausea and vomiting. Nausea and vomiting can occur in many illnesses, but when linked to the pancreas, they tend to be persistent and severe. Acute pancreatitis causes sudden inflammation of the pancreas, which can result in frequent vomiting. In cases of cancer, A tumor might press against parts of the digestive system, physically obstructing the stomach or intestines. This leads to discomfort, nausea, vomiting, and an inability to eat or digest food properly. Over time, these symptoms can cause dehydration, weakness, and nutrient loss. If you're experiencing nausea or vomiting for more than a few days, particularly with abdominal pain, consult a healthcare provider immediately. Number 7. Loss of appetite and feeling full quickly. If you find yourself unable to eat more than a few bites before feeling full, or simply not feeling hungry at all, this may be more than just a passing issue. Pancreatic disease can affect how the stomach empties and digests food, often causing early satiety. This can happen when a tumor exerts pressure on the stomach or digestive tract. Inflammation and slowed digestion can also lead to this symptom. A decreased appetite, especially when paired with other symptoms like weight loss and fatigue, could indicate a serious issue with your pancreas. Number 8. Constant fatigue and low energy. Chronic fatigue is a less specific but highly common symptom of pancreatic disease. The body's struggle to deal with constant inflammation, coupled with poor nutrient absorption, can drain your energy levels. Even everyday tasks may feel exhausting. Cancer-related fatigue is also common, as the body uses up a significant amount of energy to fight off disease. In combination with other signs like nausea, weight loss, or jaundice, persistent tiredness should not be dismissed. It's your body's way of signaling that something isn't right. Number 9. Unusual stool changes. If you notice that your stools are unusually pale, greasy, or float in the toilet bowl, don't ignore it. These are signs of steatorrhea, the presence of excess fat in the stool due to poor digestion. When the pancreas fails to release enough digestive enzymes, fats don't break down properly, leading to these stool abnormalities. The color change can also result from a lack of bile in the intestines, possibly caused by bile duct blockage from a pancreatic tumor. These symptoms may be embarrassing to discuss, but are crucial for early diagnosis of pancreatic disease. Number 10. Unexplained back pain. Persistent pain in the mid to upper back can be linked to several conditions, but when combined with other gastrointestinal symptoms, it may point toward pancreatic issues. Because of the pancreas location, disease or inflammation in the organ can easily cause pain that radiates to the back. In pancreatic cancer, back pain may indicate that the tumor is pressing against nerves or has begun to spread. If you're experiencing chronic back pain along with digestive troubles, it's time to consult your doctor. Understanding these 10 signs could be life-saving. Pancreatic disease, particularly pancreatic cancer, is notoriously difficult to detect in its early stages. That's why staying alert and taking symptoms seriously is so important. Don't wait until it's too late. If you or a loved one is experiencing any of these warning signs, seek medical advice immediately. Early detection dramatically improves the chances of effective treatment and recovery. If you found this video from Trend Pop helpful, don't forget to like, subscribe, and hit the notification bell for more reliable health information. Stay informed, stay healthy, and we'll see you in the next video.